Hello, good day. My name is Jeremiah Dugisman, your student nurse for today. May I ask what your name is?
Rui Oral Stephen Vito Rento.
And how would you like me to address you?
Rui na lang.
So, Mr. Rui, just for verification, may I know when is your birthday?
January 3, 2005.
Okay. So, today I am going to be assessing your mouth, nose, and your throat.
Okay.
So, just to start, I am going to ensure privacy by closing all the blinds. So, prior to assessment, I'm going to ask you a few questions first, if that's okay.
Yes.
Okay, so do you feel any disturbance when it comes to your breathing? Have any trouble with swallowing or chewing?
No.
Okay, that's good. And do you recall any incidents in your past you, that you went to the hospital or dentist because of your mouth, nose, and throat?
No.
Okay. In your family, do you know if you have like any familial disease of the traumatic birth? Okay. Lastly, do you smoke? How about do you drink? And how many times do you brush your teeth per day?
Twice a day.
Twice a day. That's good. And now to formally start, or now to really start our assessment, I am going first to sanitize my hands with alcohol. And in our assessment, this involves touching your mouth and your nose, if that's okay with you. Right? Just to firstly assess your nose, I'm going to inspect the symmetry. And as I can see right now, it is in the midline, symmetrical. And can you look to your left? Look to your right. Okay, that's good. There's not too much to look at as it is symmetrical. That's good. And now I am going to assess the patency of your nose by occluding one of your nostrils, and that means that when you occlude your nostrils or block your nostrils, you should be able to exhale out or breathe in and breathe out properly. Can you copy in? Are you with me? Apply pressure and inhale. Exhale. Again. Inhale. Exhale. Do this on the other side. Inhale. Exhale. Inhale. Exhale. Okay. Do you find any difficulty or trouble in exhaling? That's good. Now, as proceed, I am going to check your external nose. If you feel any pain, inform me immediately. If you feel any pain, right, that's good. And now I am going to be assessing the inside of your nose. And this includes me to use a nasal speculum and the pen light. Again, if you find any trouble breathing or any pain when I'm assessing you, inform me immediately. Can you tilt your head for me? Now I'm going to use the pen light so I can see better and nasal speculum to open your nose. Okay, there's no obstruction. There's no significant findings or whatsoever. Okay. As I can see, there's no protrusions or in the nasal septum, as I can see right now, it's in the midline, which means good, no protrusions or no holes, no masses, no lesions, or the nasal turbinates are also intact. And now I'm going to move forward in assessing your paranasal sinuses or the sinuses on your side of your nose. Now, if you feel any pain, inform me immediately. But first, I am going to again sanitize my hands. Anything so far? And overall, do you experience anything? That's good. Now, moving on from assessing your mouth, as I am done assessing your nose, I'm firstly going to wear hand gloves. And as I am going to assess your mouth, firstly I'm going to inspect the symmetry of your lips. And as I am seeing right now, your lips are symmetrical. It's no pink, no dryness. It's not dry. And everything is good. The lips are heart-shaped. And now, I am going to assess your buccal mucosa. So inside your mouth. Can you open up your mouth? Two. Buccal mucosa. Pink. Not too much to worry. Okay. Here. Buccal mucosa is good. However, I do find some contrasor or Tagalog singaw. Do you recall one that you might have recorded?
I bite my lip 3 days ago.
Is it by an accident or
Yeah.
an accident? Do you feel any disturbance right now? Okay, that's good. Now, aside from it, your buccal mucosa or the flesh of your mouth is good and good. And now I'm going to be assessing your gums. Starting from the lower gums. Okay. Starting with inflammation, no redness, from your lower lip, and then the upper lip. There's no inflammation as well. Can you open and up again? Wider please. Teeth are also intact. And it's color white, which is good. And on your gums, again, there's no inflammation, there's no redness, and in your teeth, there's no cracks or missing teeth. Now I'm going to be assessing your, again, mouth. Now I'm going to be inspecting your uvula and tonsils. Can you open up your mouth again? Can you stick your tongue out? Can you say for me? Okay, it's good. Your tonsils are intact. There's no inflammation or no fatigue or no protrusions, no presence of tonsil stones. Your uvula is in the midline. It's good. And when you say your soft palate is rising. Good. And now I am going to be assessing your mouth, or rather your tongue. So by the use of the gauze-pad. So if you feel any pain as I am touching your tongue, inform me immediately. Can you stick your tongue up for me? Did you feel any pain? Okay, that's good. And now I'm going to move on to the last procedure, the last assessment, which is your gag reflex. Open up your mouth again. Sorry. Since you have emitted the sound, which means you have a gag reflex and it's active, which means that your vagus nerve is active and it's not much to worry about. And again, just to summarize everything up, from your nose, it's in the midline, it's symmetrical, there's reception, no protrusions or holes, no obstruction, as you didn't have any trouble breathing. To your mouth, or from your lips, it's symmetrical, heart in shape. Inside your mouth, it's pink or buccal mucosa, and it's not too much to note, except for that contrasor. However, I'm gonna be taking note of it. Your gums, no inflammations, your tonsils, for inflammation, tonsils, no inflammation, uvula is in middle, teeth is intact, no missing teeth, no pain as I touch your mouth, nose, and then your tongue. And your vagus nerve is also reactive. Do you have any questions so far? Okay, so right now I'm going to write everything down, and then inform immediately and report immediately to the physician, and I'm going to call you again if there will be further evaluation or assessment that is needed to be conducted. Okay? Thank you again, Mr. Louis.